We have seen all along that to have an lasting impact, you need to be working through local organizations and local community structures, right? The local faith-based organizations are the ones that have the trust of the communities and can best represent them in finding solutions that are going to be lasting and work. They also become very important advocates within their government systems at the local, regional, and national levels to ensure that the governments are putting resources toward this important problem of health. You know, the reality is governments are losing enormous shares of their potential GDP or income by having unhealthy populations. And they need to be investing, particularly in the youth and the women in their countries, to ensure that they are as productive as they can be and be successful in the international markets.
What does it look like when it comes to implementing your models and services on the ground?
Traditionally, in the past, it was that there were big donors like USAID or the UN or other European donors, and they needed implementing agents, and they would come to international nonprofits like Corus International to execute and implement our programs, and we would go and connect with local partners to do the grassroots, on the ground delivery of services at the local level. What we're seeing now, though, is that more of the role for the international NGOs is to help build the capacity and to support the local NGOs for them to take much of a more of a lead role in this. The area that we're finding most work still needs to be done and where there's value added from organizations like Corus International is kind of the systems that need to support and help in this process, as well as the issues related to monitoring and evaluation, finance, compliance, all these big issues required by big donors that require lots of reporting, lots of data, lots of technical aspects to this. The good news is that what's happened over the last several decades is the intellectual capital in African countries has grown tremendously, right? You don't need doctors from international NGOs anymore, except in perhaps humanitarian situations of urgent conflict or crises where you just need a surge. You have the technical expertise, you have the medical expertise, you have the health expertise, but the systems around all those people aren't yet built up and strong enough to deliver services throughout and to reach the unreachable or the most vulnerable populations. So what's happening is there's a big change and dynamic happening now, where on the service delivery side, African organizations like these faith-based organizations are stepping forward, taking that role. And now international nonprofits and donors are moving to a secondary role, trying to manage and ensure that the resources are used well, documented, and ensured that they went for what they were supposed to go for. And the results and the impact are proving the success of the design of those projects.
How do you measure impact?
Well, for us, impact at the end of the day is the outcomes that we see in the populations that we're trying to support and serve, right? So you measure it through number of diseases, the mortality rate of infants, the mortality of mothers giving birth, the number of cases of malaria, the delivery of pharmaceuticals, the number of vaccines being provided, and the impact that's having on reducing disease. But even more important, and it's a little harder to measure, is that capacity building piece that we were talking about. So what we watch in that particular context is to see when and how our local non-government organizations, as well as local governments, ready to step up and be direct recipients of international assistance and be able to deliver those with similar results that the nonprofits produced, right? And that's not always a given, right? Because as I'm sure you know, in many government contexts, including in developed countries, the government resources don't have the same impact as when a local community-based organization delivers it, because their overheads are much less and they're able to manage much more closely and directly. So we're watching that piece as well. But there's lots of measures in here. But at the end of the day, you know, for us, let's focus on getting universal health coverage across Africa, that everybody has the ability to access healthcare, and that we're no longer losing children on preventable diseases and that they're dying before the age of 5, or mothers are dying in childbirth for no reason, or simple diseases that can be solved through vaccines are no longer becoming epidemic across particular areas or regions or communities or countries because we were able to get the vaccines there and the medicines to help on recovery.